Life can be so busy that sometimes it can be easy to put off or dismiss seeing the doctor, especially when it comes to pelvic health. But our next guest wants to educate us why men need to be focused on their health issues and how simple rehab can help with everything from erectile dysfunction to incontinence. I headed out to Rehab Associates of Central Virginia to learn more.
Male pelvic health is not something new, but it's not something that's really been talked about or researched that much. It's maybe about 20 years behind female pelvic health when you look at it, which is problematic because on a world scale, 1 in 6 men are going to be diagnosed with prostate cancer as opposed to 1 in 9 women will be diagnosed with breast cancer. In the U.S., out of every 100,000 men, about 13 or so are going to be diagnosed with prostate cancer, of which 2 or 3 cases will be fatal.
Oh, wow. So let's talk about some conditions men should seek out medical attention for.
So typically when you think of prostate cancer, if you're looking at things, some of the signs, difficulty starting the flow of urine, change in urine stream, some burning sensation, the bladder doesn't empty all the way, you can get some blood in the urine or semen, you can get pain in the back or pelvis, weight loss. Those are the type of things you want to start thinking about. With colorectal cancer, it's probably a little more problematic because in the beginning, when you have polyps, you don't really even notice that you have an issue. But if you have change in bowel habits, blood in the stool, again, pain in the back, pelvis, weight loss for no particular reason, pain waking you up at night, those are the type of things to worry about. For testicular cancer, that's one of the things that is more prevalent in younger males, ages like 15 to 34, but it's not as prevalent. It'll happen maybe 5 out of every 100,000 people. And they usually will detect it if they feel a bump on the testicle when they're taking a shower, things like that.
Interesting. And then let's talk about other conditions that men may suffer from, like erectile dysfunction.
So erectile dysfunction, about 40% of the men by the age 40, 50% of the men by the age 50 can suffer from some sort of erectile dysfunction or benign prostatic hyperplasia with difficulty obtaining an erection or maintaining an erection. So with those are the type of things we say, go, see the doc, to make sure that it's not some other issue going on, but physical therapy can help in treatment of this as far as weight loss, general exercise, and specific exercises to go ahead and facilitate erections.
And speaking of which, folks can actually get treatment and you can help with that, right?
Yeah, they can come see a physical therapist directly, depending on their insurance. But we go ahead and treat that, and we'll go ahead and screening. Some of the other issues that folks deal with is incontinence. 15 to 30% of folks over 60 will struggle with incontinence. And this can be relatively significant because it's one of the leading reasons why folks actually are admitted to nursing homes. And the reason is they're afraid they're going to have an accident, so they rush to the restroom and they'll trip and fall and break something. So they're admitted for that, but they can have issues with bed sores and rashes, but on a less significant level, people, if they're afraid they're going to have an accident out in public, they start to withdraw socially, so they become depressed, and those can be very significant. That's many things where physical therapy can help in treatment of incontinence, because one of the valves that hold the urine from leaking is made out of skeletal muscle, just like your bicep. So if you make that stronger, it will go ahead and prevent the flow of urine. So Emily, if I said you want to go ahead and bench 150 pounds, you wouldn't be able to do it right away. It's something we have to do specific exercise consistently. You'll get stronger, and then you can go ahead and bench 150 pounds. And same thing with improving the sphincter control to decrease urine leakage.
So it sounds like to me, don't forget to visit your doctor for your yearly. And if you're having issues, see if physical therapy might be the right choice for you.
It can be. And one of the other things I suggest is going out to the partners and wives. Men are not necessarily the best at getting health care. And health care choices are really driven by the female or the wife. So if someone is complaining that they're having, pelvic pain, erectile dysfunction, bowel problems, don't wait. Go ahead and get them to the doctor. That's the best thing to do.
And Rehab Associates of Central Virginia have been around for a while. You guys are award-winning. You have many area locations. And if you want to learn more, you can just call to find out more, right?
You are absolutely right.
And to learn more about men's health or how Rehab Associates of Central Virginia can help you, give them a call, 855-RAC-4PT. Find them online at racva.com or check out their social media pages. And we'll be right back.